Neil Shaw, and I'm a sales engineer here with LinkMD. And I have the pleasure and speaking with Dr. Akash Parikh, and I'll let him give a brief introduction on himself.
Really great to be here chatting with you, Neil, about this important topic. As you mentioned, my name is Dr. Akash Parekh, and I'm a radiation oncologist by training, and one of the co-founders of LinkMD as well. And also on the side, a business student at the Wharton School, and excited to chat with you about this important topic today.
Awesome. Thanks, Akash, for taking the time and looking forward to kind of getting through the ins and outs of prior authorization. So that said, let's go ahead and get right into it. I want to kind of speak through some of the challenges that the healthcare system currently has, specifically around prior authorization today. And that said, so can you just kind of shed some light in terms of what prior authorization is and why it's necessary in the healthcare system?
Yeah, absolutely. It's a great question, and I think a lot of people, don't know the full background about it, and I think that it's helpful to start there, like you said. So, prior authorization is really a process by health insurance companies to determine if they should cover a specific medical service, procedure, medication, or device, whatever it is, before that service is provided. And the intention of it was set up as a checks and balance system. So it's a checkpoint where the insurer can review the request from the healthcare provider to ensure that whatever treatment is being prescribed or diagnostic is being prescribed, is it really medically necessary, and does it align with clinical guidelines? With that being said, it has benefits. It's theoretically supposed to help reduce the cost of expensive treatments that a patient might not need, or expensive medication that the patient maybe shouldn't be getting at this point in their treatment. And it can also, potentially prevent dangerous medication combinations as well. So those are sort of the foundational principles of a prior authorization.
Awesome. No, that sounds good, and I appreciate that sort of insight. Now, what are some of the common challenges that you, as a healthcare provider, face when dealing with prior authorizations?
Yeah, it's interesting. I think that this is such a multifaceted question, and there's been much written about this, and even researched about it over the past couple years, because while it was set up for this safety process, cost control, quality assurance, fraud prevention, it's really become this very cumbersome ecosystem that actually has not served in many ways the purpose for which it was created. And in fact, at a most basic level, I guess we'd have to sort of start at how the process works. So as a physician, if I recommend that a patient get a particular treatment or a particular diagnostic, that particular order has to go to the insurance company, and the insurance company will decide, yes, no,
Mhm.
we'll cover it. And as that, just that administrative process, um, is in itself something that costs the healthcare system over $1 billion a year, because of all the additional staff that have to go into this process of preparing this prior authorization. But beyond that, the burdens really are so multifaceted. Very common complaint is patient delays. Um,
Mhm.
when we're ordering, for example, for a cancer patient, a imaging scan that's necessary to stage their cancer, we cannot treat the patient until we get the results of that scan. Now, if that scan has to be approved or it's denied, or the insurance company is saying, well, we need to start, at a different type of scan, but we as a physician know that this is the appropriate, you know, diagnostic to do so that the patient get treated. The patient isn't getting treated for another, 2, 3 weeks. Oftentimes, if we're talking about medications, if the insurance company is trying to reduce costs, sometimes the exact opposite happens because a patient will take a medication that they shouldn't take that then doesn't work, that they will also have to pay for, only to eventually end up paying for for the
Hmm.
additional medication that we originally prescribed. So the challenges are not just for physicians on an administrative level, but they're also very much and most importantly for patients.
So within those mentioned challenges, right, how would you say that impacts patient care and treatment timelines as it is?
Yeah, it's going to vary. I would say specialty to specialty in terms of the exact delay in care that can occur for patients. But the AMA has done several surveys on this that have been published recently, and as like a number, almost 94% of physicians that were surveyed in that study said
Hmm.
that that's 9 out of 10 physicians said that the delays result in worse outcomes for patients. And in terms of the delay, oftentimes what'll happen is you'll lose a patient because they're getting frustrated with the medical system. They won't actually come back to get the care that they need. They'll have higher out-of-pocket costs because maybe they don't want to wait for the delay and they'll just pay for the diagnostic or the treatment out of pocket. Um, so the delays in care are significant for patients, um, and and also very frustrating from a provider standpoint as we're trying to do the best we can for
Hmm.
patients. Furthermore, contributing to actually the epidemic of burnout that's also occurring for physicians.
Gotcha, gotcha. So now, in your experience, what are some of the more significant bottlenecks in this like prior authorization process?
It's a great question, kind of digging into to the details of the process.
Hmm.
Much of so much of the problems that occur um, are they're kind of several fold. One is the opacity of what the insurance company is looking for. So when I submit an order for a patient, my administrative staff will go into an insurance portal. Now, every insurance company has a different portal or different requirements for the same exact order.
Hmm.
If we take an MRI, one insurance company will require certain information, another company will require another piece of information, another company will, insurance company will require a separate set of information. So the process is a bit opaque as to what exactly an insurance company is looking for. Um, the other bottleneck is just the amount of time it takes for an insurance company to let us know what their result is. Uh, there as of right now, there's no like set guidelines that the results have to come in a
Hmm.
certain amount of time, depending even on the urgency of the request. The other, interesting thing is all of this is manually done. So my staff actually have a spreadsheet of all the patients that they have submitted prior authorizations for, and every week or every other day they get together and they go through their Excel spreadsheet and say, patient name, what did they require, what has the insurance company actually said that they still need, where
Hmm.
is the prior auth in that process. So a lot of those bottlenecks are surrounding just the process, which is very manual at this point. I've even had a fellow physician friends talk about faxing insurance companies various things, or insurance companies communicating through fax, which seems like an archaic method to be using these days.
Definitely, definitely. And as you kind of speak towards that manual process, how do these delays affect patient and healthcare providers alike?
Yeah, I think we touched a bit on how they impact the patients. I think patients, when they're getting this care, they're nervous, right? They my
Hmm.
my patients in oncology are incredibly nervous about any delays. I think about, on a personal level, my own father who was denied a PET scan for the prostate cancer he had, and they told him he had to pay $6,000 out of pocket, and so he had to proceed with a different type of imaging beforehand, only to eventually get a PET scan. So this caused anxiety to him and to me. So if and all of us in our family, and that's pretty emblematic of other patients. So I think on the patient end, it's that anxiety. It is the higher, out of pocket costs. I think on the physician end, honestly, we as physicians spend, I think the recent surveys are like 80% of our time in front of a computer documenting things. So then this is another administrative burden you're adding on
Hmm.
to our everyday that's taking away from spending time with our patients. And so it contributes to burnout. Sometimes it contributes to just not being able to put enough resources into getting a prior auth appealed in case it's rejected. So in terms of the process, once a prior auth is rejected by a insurance company, we might have the
Hmm.
chance to appeal it. But if you don't have the staff to be able to do that manual process, um, sometimes practices are not able to push for what they believe is the right treatment, and they will just agree to whatever the insurance company has said the physician should do. So the insurance company is dictating what we should do. So, I
Hmm.
tell you, whenever I ask my fellow physicians, what is your biggest pain point in terms of something that you dislike the most about your practice, and they'll say prior authorizations. It's a complete time sink. And so I think from the provider end, it's a very frustrating process. And I'll add one more thing. Sometimes once a prior auth is done and the insurance company rejects it, we have to, as physicians, get on the phone and
Hmm.
talk the to the insurance company, another physician in the insurance company, and basically defend ourselves or argue for why this patient needs what we recommended. And sometimes these physicians on the insurance side are not even in the specialty that we are in. So I'm an
Hmm.
oncologist, nothing against a, um, somebody who's not an oncologist, but they don't know the nuances of my practice, just like I would not know the nuances of an orthopedic surgeon's practice because I'm not an orthopedic surgeon. So it's frustrating also from the end in that you are communicating with somebody who doesn't know the details of your practice, but they are just following guidelines that the insurance company has set for acceptances or arbitrary denials.
Gotcha. Gotcha. And with that said, right, so what role do you see technology playing in improving just the overall process when it comes to prior authorizations?
Oh, it's a very exciting area, and I think that there is I mean, the role that technology can play in this process is truly extraordinary. I think
Mhm.
um I guess if we talk about how that process would work, a lot of this can be automated because the information that a insurance company needs in order um or that a prior authorization requires, that information is all within either a physician's note or at least within a patient's chart. And so the ability to aggregate data across various
Mhm.
components of a patient's electronic medical record and compile it into anything that's relevant for
Mhm.
submitting the prior authorization is sort of the lowest hanging fruit in this process. This would then free up all of the administrative cost to our staff, both in time and expense, of having to manually fill these prior authorizations out. Additionally, as I mentioned, a lot of this is done through Excel. Keeping track of patients is done through Excel spreadsheets and the like. So that's an easy fix in terms of the way technology could potentially streamline that process by providing a dashboard of where all the patients in your clinic stand in terms of their prior authorization process. Furthermore, you know, eh, whenever we are discussing with an insurance company why a patient needs a certain treatment or diagnostic, it's always good to be armed with data. And that's a very reasonable thing that insurance companies should admittedly ask for. And so the ability to have technology or AI specifically gather appropriate data from
Mhm.
reputable resources like PubMed or reputable journals in order to help us justify why a patient should get particular care would be another place that technology could really help us as physicians save time.
Gotcha. And then with that said, I know you sort of touched on automation, but I wanted to double click in that a little bit more. So, how would you say automation can specifically help in just reducing that time and that effort involved when it comes to just obtaining a prior authorization?
Yeah, so I mean, the way that the process sort of works is that when you're submitting a prior auth through an insurance portal, you're having to input a lot of data for each patient into that insurance portal. That data is going to come from a patient's chart, the physician note, the imaging that the patient has gone through. All of that data is manually input for the prior authorization submission. So being able to automatically import that would save hours and hours of time. I mean,
Mm,
it's if you have the average practice has about 45 prior auths per week, you know, if you took even 20 minutes or 30 minutes per prior auth, you're talking about, you know, hundreds of hours saved over the course of a year, just by not having to manually do that process. So a lot of this is about um, sort of an intelligent system or an automated system of pulling the appropriate and relevant data for each patient
mhm.
into the submission process.
Gotcha. And now, what are the potential benefits of integrating in an electronic healthcare record with with like prior authorization systems?
Yeah, I mean, I think now we're sort of segueing a little bit more into what the best way um, to automate this process. What is the
Hmm.
best way for a potential solution to work with physicians and physician practices to streamline this process? And there's multiple ways
Hmm.
to approach it. But if a system was an automated system was integrated into a electronic medical system, then it would be able to extract the data for a patient from the EMR where that patient's information resides, and then
Hmm.
automatically connect externally to the insurance portal, and then sort of serve as the connection between a patient's medical record and the insurance portal. So, if we're talking about a potential solution, integrating it within the EMR would give it all the information it needs in order to submit a prior auth automatically.
Gotcha. So, with that said, considering the challenges we've discussed, how do you think a solution like LinkMD can address some of these issues?
Yeah, I think LinkMD is a very dynamic solution that is very provider and patient focused, and would be able to significantly reduce the burden, both from a cost perspective and a time perspective for physicians and physician practices, because it's something that integrates into the EMR and is intelligent enough, per se, to extract the relevant data based on a patient's particular case, extract that data, and then submit it into the prior authorization system while
Hmm.
also generating a summary, almost like a letter of appeal before a letter of appeal is even needed, but basically summarizing that patient's data into a letter of appeal that would be able to indicate the patient's history,
Hmm.
why, what treatment they need, why they need it, and then also provide data and defend, um, or justify why the patient would need a particular treatment. So it 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 would help not only, as I mentioned, in terms of cost and administrative burden, but it would also just help because it's a perfectly integrated system, and it would be seamlessly working with providers and provider practices in terms of convenience, because that is
Hmm.
um, incredibly important to all physicians. If a system works really well but is cumbersome to use, no one's going to use it. But having a system that is integrated and seamlessly goes into already established workflows, um, is really what gives LinkMD an edge, and that it can be customized to practices. The way LinkMD works and sort of the way the protocol works for us is that, we sort of tailor it to a particular practice.
Hmm. Gotcha. And now, what features and capabilities would you expect from a platform like LinkMD in terms of streamlining the process of prior authorizations?
Yeah, I mean, that's a great question. So, I think as a provider, when we look at it most basically, um, every prior auth is going to be different, and there's going to be particular pieces of information that are important for an imaging order versus a procedural order, versus some sort of laboratory order. And so I think from a provider end, what I would want from any sort of uh, platform that automates this process is that it would know what the relevant information is in order to justify a particular claim,
Hmm.
and that it would seamlessly do so based on the information already within the patient's chart, so that my staff is not manually taking pieces of information from a patient's chart and putting it into the insurance portal. The next thing I would expect is that should the insurance claim be denied, and we need to, as a practice, submit a letter of medical necessity, or I need to get on the phone with the insurance company and justify it. I would want a rundown, or a summary of the patient's case scenario and some data pulled from reputable sources that I can use to justify my claim or my medical decision making.
Hmm.
That would save me 30 minutes of prep for some of these insurance calls that I have. Or if it's a letter that needs to be drafted, it would save me 30 minutes in preparing that letter as well. So that's another capability that I would want. I think on one other thing that I would add on the administrative end is I had mentioned these Excel spreadsheets, or however every practice keeps track of, where patients are in that prior authorization process once they have been submitted. Instead of that being manual for my staff, it would be great if, as updates came from insurance companies, there was a dashboard that had every patient in my clinic and where they stood in terms of their prior auth status, and those were just updated automatically.
Gotcha. And with that said, right, so you have an understanding of LinkMD's approach. How do you feel about this approach when it comes to that automated appeal letter generation and that physician peer-to-peer co-pilot as it benefits the prior authorization process?
Yeah, I mean, so many of the things that I mentioned in terms of what I would want in
Hmm.
in a solution like this are are the foundation of how LinkMD was built. And so, keeping providers and provider practices at the forefront of what we do, and making it convenient for them to
Hmm.
utilize the service was the very foundation, so that we reduce burnout, so that we allow providers to focus more on patient care, so that we
Hmm.
reduce the cost of the administrative burden to the practices, so that there are fewer patient delays. So, with all of those principles in mind, BlinkMD was generated. Um, and and what I will add is that it not only is a solution that integrates into the EMR and the portals and connects them and inputs the appropriate information, but the really also very unique part is that it has a feedback loop built into it from an engineering perspective, so that once the results of a prior authorization appeal or letter of medical necessity, once the result comes through, the system takes that as another input. So the output becomes the
Hmm.
input and uses that to continuously refine the process. So it is learning what works, what doesn't, how to construct these. It already knows, but it's getting even better. So all the things I mentioned before about what I would want in a system are already built into the solution. And then beyond that, it's a constantly evolving learning system as well.
Awesome. And as we wrap up, I only have a few more questions. So looking ahead, right, what are your predictions for the future of prior authorization in the healthcare industry overall?
Great question. I think a lot of it is changing because a lot of advocacy organizations are recognizing that you know that's just the burden that this is causing to patients and physicians and practices. And so, CMS is rolling out new rules to hold
Hmm.
insurance companies accountable for the delays in care that they are causing, for the automatic rejections. I mean, more recently in the news this past year, a large insurance company was caught using automated denial processes, not through any medical reason, but just an automatic rejection that was not being intelligently utilized. And this was a major insurer. And so I think as there has been a um, much more robust focus on the burden that prior authorizations are costing on multiple fronts, I actually think
Hmm.
in the next couple years, we will see a significant change, um, not only in how the process is done, but also in terms of regulations, to help ensure that insurance companies are not automatically rejecting claims for patients. But I think a lot of change, frankly, is on the horizon,
Hmm.
and insurance companies know it, EMR systems know it, and smart startups also know it.
Awesome. And with that said, how important do you believe it is for healthcare providers to adopt advanced technologies like LinkMD to stay competitive and truly improve that patient care process?
Oh, I mean, they're critical. I would say, just from a very broad perspective, I think that embracing um, things that can be automated, or things that um, allow you as a physician to practice at the top of your degree, is what we always say, are going to be a competitive advantage. Um, Not only because it's going to help patients, things will be faster for them, but also because you'll retain your workforce in healthcare. You'll have less burnout. You will have less staff turnover. You will have your non-physician staff, secretaries, admin staff, who are not
Hmm.
totally stretched thin from working day and night to try to get prior auths approved, while also managing the other parts of a practice. So I think that, you know, It's a critical necessity just in general for practices to
Hmm.
embrace the ways in which health tech um, can operationalize their practices for the better.
Awesome. Thank you, Akash, for the time today. That pretty much wraps up all the questions we have for you today. So, wanted to thank you for your time and appreciate all the insights provided.
Thank you for having me, Neil. It was a pleasure to talk to you about this incredibly important topic and look forward to further conversations.
Awesome.